Yes, good evening. Good evening, everyone. Welcome to yet another session that is part two of general anatomy. So, before starting the session, just give me a thumbs up in the chat box that the audio and visuals are perfectly fine. Yes, Dr. Naushad Ali, बिल्कुल शुरू करते हैं. Vedant Patil, good evening. Amir, good evening. Medico, good evening. Yes, Alu, good evening. Satya, good evening. Kanupriya, good evening. Good evening. Good evening, guys. I hope my voice is audible. Health and fitness tips. Yes. Hello, bacha. Yeah. Likita, good evening. Yes, good evening. Carry on. Yeah. Okay. I hope the audio and visuals are perfectly fine. So let's start the class without wasting. Anjana Paul, good evening. Yes. Without wasting much more time, just so we have already discussed the general anatomy part one yesterday, right? Where I have discussed the concept of the anatomy, the regional and systemic anatomy. Yes, we have discussed the normal anatomical position along with the transverse section of limb. Yes, Sajjad Hussain, salam. Yes, Vedant, hello. Unseen world, good evening. Yes. I hope it's all fine as of now. Or chalo. Let's start with the class phase. So the very first thing that I will be discussing right now in part two, it is the different positions, right? So different positions in anatomy. The very first one, the one which I'm going to discuss, it is the supine position, guys. The supine position. Now you can see the person over here. You can see this person over here. The person in this position, it is lying on its back, right? The person is lying on its back. Now meanwhile, guys, you guys are going to comment in the chat box that this position is required for which type of surgeries. I'm waiting for you people. I have already told in my previous lectures that it is like an interactive session. It is not only that I will continue, no, I will only write and I will speak. You guys are going to speak via the chat box. Yeah, Osama, good evening. So I'm waiting for you people to tell me that this particular position, in this position, which surgeries you can do. Yeah. So meanwhile, let me just pen down the definition over here. Yes, you already know the supine position. It is the position where the person, yes, where the person is lying on its back. The person is lying on its back, right? The normal position, and and yes, which type of surgeries? Yes, abdominal surgeries. Yes, Ishrat Osama. Okay, Vedant. Cardiothoracic surgeries. Yes, very good, guys. What about rest? Likita, abdominal surgery. Okay. What about the rest, guys? Huh. Hmm. So the commonest example that Vedant has already told us, yes, it is the cardiothoracic surgery. Cardiothoracic surgeries are carried out in this particular position. So you can very well see, yes, the cardiothoracic surgery. Now, yes, Ishrat, very good. Abdominal, pelvic, cardiac, yes, health and fitness tips. Yes, guys. Huh. Now I just want to know, guys, I just want to know, okay, thoracic basically involves, okay, the thorax part, it is between which two anatomical regions, right? The thorax part, it is between which two anatomical regions? Can anyone tell me? Yes, medical, very good. It is the appendicitis surgery we can also do. So yeah, before you comment on this, yeah, let's move on to the next particular position. That is the prone position, guys. That is the prone position. Now, prone. You can very well see the picture over here that the person over here, it is lying on its abdomen. Okay, so remember the person is lying on its abdomen. The person is lying on its abdomen, right? Yes. Tarun Singla, it is basically the neck, and the abdomen region, right? And the thorax is this particular region, right? So it is between the neck part and the abdomen part. Basically, this is the thorax, right? In thorax, we have two major organs, that is the lungs and the heart. Yes, Anil, happy Holi. Anjana, very good. Spinal surgery is very good. Anil Seni, very good, beta. Very good. Yes, this particular position where the person is lying on its abdomen, it is basically used for, yeah, I can simply say the spine example that you have to, or just simply we can write it over here that it is for spinal surgeries, right? Spinal surgeries. Spinal surgeries. So yes, Raviraj, Suhan, hello. Sushan, Imba, hello, hello, hello. Raviraj, yes, it is the spinal surgery, guys. It is the spinal surgery. Yes. Now, coming on to the next one, that is the fundamental position, guys. That is the fundamental position. Now, I have a question to everyone over here. I have a question to everyone over here that what is the difference, guys, between the normal anatomical position and fundamental position? If you just see the picture over here, if you just see the picture over here, what exactly is the difference? What point is there is only one point difference between the normal anatomical position and the fundamental position, guys. Can anyone tell me? Yes, yes, Likita, very good. We can do that as well. Yes. चलिए बताइए. Hmm. I'm waiting for the answers. Can you just point out the difference between the normal anatomical position and the fundamental position? Standing position is okay. Yes, Ishrat Fayaz, very good, beta. It is the direction of the palms. It is the direction of the palms. Very, very important, guys. Yesterday, only in the normal anatomical position, I have told you that the palms are facing forward. Yes, Satya, very good. Naik, very good. Anil Seni, Sufianas. Okay, his hands. Aman, very good. Very good, Aman. Okay, 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 guys. So you should be aware that we have already discussed this particular position yesterday. So you guys know that this is the normal anatomical position, right? So this is the, okay, let me just write it over here. Hmm. Okay. Hmm. So you guys already know that this is the normal anatomical position. Yes. Sushan, very good. Subhajit, very good. This is the normal anatomical position. Normal anatomical position, right? In which you can very well see over here that the palms are facing forwards. The palms are facing forwards in the normal anatomical position. In the normal anatomical position. Now. Yes, we are going to discuss this. Itis is inflammation medical, right? So over here, just remember that in the fundamental position, the palms are facing towards the sides of the body. Yes, the palms are facing side. Good evening, Amir. Yes, I'm very much good. So please write down. It is same as it is same as the normal anatomical position. It is same as the normal anatomical position, except the palms which faces towards the side of the body, towards the side of the body. So it is the very normal position, right, guys? So you just have to remember the difference between the normal and the fundamental position. The normal and the fundamental position, guys. So over here, remember, it is exactly similar to the normal anatomical position. Only the palms, they are not facing forwards; they are facing towards the side of the body. So that is the key difference over here. Imamul Haq, good evening, beta. So I hope till now it is clear. So I hope you all guys are writing the notes along with me. You all are listening to me. Yes, just give me a thumbs up in the chat box, guys, that you all are present over here. You all are listening. The audio visuals are perfectly fine. And you all are revising along with me. Yes, sure. Coming on to the next one, that is the lithotomy position. Coming on to the next one, that is the lithotomy position. Now you can very well see the person over here. Okay, the female, it is basically lying on its back. Yes, Naik, Vicky Chaudhary, very good. Vicky Chaudhary, very good. Zara Aftab, very good. Aman, very good. What about rest, guys? Are you all alive? Shelly. Hmm. Sure. Very good. Hmm. Yes, the pregnancy position. Anil, okay. Imamul Haq, yes. Vishan, affirmative. Okay, perfect. Satya, very good. Now, guys, you already know over here that the person, okay, the person is lying on its back. The person is lying on its back, right? Now, you can see with both the foot. Now, I have already told you that these are the foot, right? The foot of the person, right? Tarun, very good. Anjana, very good. Yes, the pelvic surgery is the delivery. Yes, yes, yes. Raymond, very good. I'm listening from Uganda. Okay, thank you so much. Yeah. Hmm. Yes, Imamul Haq. Yes. Okay, perfect. Now, you guys already know that the foot over here, the person is lying on its back. Remember, with both the foot, remember, with both the foot supported, supported with the help of foot rest. Okay, so we have foot rest over here, the foot rest where both the foot are basically supported with the help of, yes, the foot rest. Now guys, again, this particular position, it is basically used for, as already told by Anjana. Yes, Imamul, yes, Satya, very good, they have already told. So remember beta, it is used for all the procedures, right? All the procedures. And let me just write down, it is obstetrical and gynecological procedures. Gynecological procedures. Now, guys, when I say obstetrical and gynecological procedures, guys, I am basically telling you about the very common. Okay, now you might have heard about the cervical cancer, right? Now, in the cervical cancer, basically one of the screening tests that we used, it is the pap smear test. We are taking the yes, smear, the cervical smear from the cervix of the female, right? So over here, basically, these are also used for certain procedures along with the delivery part. You guys are very well right. Apart from that, this position, it is also used for one of the surgeries, guys. Yes, Shalini, very good, beta. It is used for genitourinary surgeries, right? This particular position is also used for genitourinary surgeries. It is not only the obstetrical and gynecological procedures. Along with that, this particular position has a wide role in genitourinary surgeries, right? Yeah. So that is the lithotomy position, beta. That is the lithotomy position. That is the lithotomy position, right? So I hope this is clear to everyone. Yes. अमन अभी तो यही चल रहा है. We'll see. Yeah. Yes, Imamul Haq, very good. Hmm. Now coming on to the next one, that is the lateral decubitus position. Now this position, if you can just see in the picture over here, beta, if you can just see in the see the picture over here, basically what is happening, the person is lying on one side of the body. The person is lying on one side of the body. The person is lying on one side of the body. Now, can anyone tell me? Yes, Anil, you have already told with aha. The moment I start asking question, you already know what sir will ask. No. So you guys will tell me this position is used for which of which surgeries, guys? Huh. Yes, Anil Saini, yes, 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 you are right, right, Anil, very good, Anil. That is used for the ear surgeries. It is best for the ear surgeries. So you have to remember this particular position. It is best for ear surgeries. The ear surgeries. Yes, very good, Aman, very good, Aman. Yes, it is Likita, very good. Ha, we can do that. Yes, Zara, very good. Dipender Singh, thank you so much. Satya, very good. Shalini, very good. It is best for the ear surgeries. It is best for the ear surgeries, right? Now, coming on to the next topic, that is the anatomical planes. But before that, please tell me if you guys understood the supine position, the prone position, the fundamental position, the lithotomy position, and the lateral decubitus position. All the five positions that we have discussed in this 10 to 15 minutes. I hope it is clear. Yes, protoscope, ear surgery is very good. Mudassir, hello, hello, hello. Yes, protoscopy, very good. Pradeep, yes. So just give me a thumbs up, guys. Nancy 124, very hello, hello, hello. Now coming on to the next topic, that is the anatomical planes. But before that, I want a thumbs up from every one of you that you guys understood whatever we have discussed in the first 15 minutes. Hmm. Naik, Sarah, Sushan, Shalini, guys, you guys have to interact with me, right? So that I can be, I am actually surrounded by the walls over here. So if you don't reply in the comment section, so it's like me teaching the walls. So yes, Shalini, Satya, Zohra, very good, guys. Now coming on to the next particular topic, that is the anatomical planes. Now, guys, in 2020 also in FMG exam they have asked one question from this particular topic. Although, yeah, these topics are very simple, but yet most of the students try to skip it. But remember, guys, the examiner can ask anything from anywhere. Yes, I will come, Mudassir, to this particular topic. Yes, yes, George. Hmm. Okay, perfect, guys. Now coming on to this anatomical planes, guys, the very first one, that is the mid-sagittal plane. Now, guys, before that, let us just try to look at this particular position, guys. Let us just try to look at this particular position, and yeah, everything in anatomy, I have told you, it is, yes, everything in anatomy, it is described in this particular position. Everything in anatomy, it is described in this particular position. So you guys already know that this is the normal anatomical position. This is the normal anatomical position. And in anatomy, all the terminology, every plane, every movement, every term, it is described with respect to this particular position. Yes, Ahmed, I will be coming to that topic. Please continuously don't ask that question. Yeah, this is the normal anatomical position. Now, guys, you can very well see the very first one, that is the mid sagittal plane, guys, the mid sagittal plane. Now, guys, in this plane, what we are doing, we are dividing the entire body, okay, into two parts equally. It is a plane, okay? It is a plane which divides the body into two equal parts. Morphologically, you can see that this plane, it is passing through the midline of the body. This plane, it is passing through the midline of the body. Hazrat Amreen, okay? Yes. Pradeep Raj, very good. It is passing through the midline of the body, guys, right? So remember, that is the mid sagittal plane. That is the mid sagittal plane. Now, guys, why sagittal? I will be coming to the sagittal word again tomorrow, because in general anatomy, I will be teaching you the bones, the joints, and everything. So there is something, a suture which is present in between, that is called as the sagittal suture. Okay, a suture that is exactly present in the mid. Okay, the cranium bones in the mid over here. So you guys have to remember it. This name is basically on that particular suture over here, right? That is present. So remember that mid sagittal plane, It is the plane. Yes. Satya, very good. Imamul Anil, very good. Very good, guys. It is the plane that divides the body into right and left equal halves. It is a plane that divides the body into right and left equal half. Right? Now, guys, coming on to the next term, that is the sagittal plane. Very, very important. Now, what is the difference between the mid sagittal plane and the sagittal plane? Just try to look at this particular diagram only. Now, guys, the sagittal plane, it is parallel to the mid sagittal plane, right? It is parallel to the mid sagittal plane, guys. It is parallel to the mid sagittal plane. Now, this is also called as the parasagittal, okay? Parasagittal plane or simply the sagittal plane. Now, guys, I have a question to everyone over here. Yes, Aman, you are right. I have a question to everyone over here. In parasagittal or the sagittal plane, does the right and left part is equal? Is the right part and the left part equal, guys? If you see, this is dividing into these two proportions. Are they equal, guys? So I'm waiting for your answers, guys. In parasagittal plane, it is not passing to through the midline. It is parallel to the mid sagittal plane. It is parallel to the mid sagittal plane. It is parallel to the mid sagittal plane. Yes, it is parallel to, yes, not equal. Very good. Naik, Satya, Aman, Anil, Jora, Herion. Very good, guys. Very good, very good. You guys are right. It is not. हाँ ठीक है. Amreen, Zara, Tarun, George. Very good. It is not equal, guys. It is not equal. So remember that. Yes, Osama. Yes, yes. Anushri. No. Very good. So you guys should know that in the sagittal plane, guys, in the sagittal plane, or I can simply say that parasagittal plane, the parasagittal plane. Now, what will happen in this plane, guys? Yes, Dipender, very good. Imamul, very good. Yes, it is a plane parallel to the mid sagittal plane, a plane parallel to the mid sagittal plane. And over here, guys, very, very important, the right half, it is not equal to the left half. The right half, it is not equal to the left half, right? The right half, it is not equal to the left half. So that is something you have to know. Now, this is like this question. Please put a dollar sign on this. This has been asked in the previous year question, that is FMG. Yes, December 2021. They have asked this question. FMG December 2021, they have asked this question, very, very important. The coronal or the frontal plane. The coronal or the frontal plane, guys. Now, guys, you already know the two terminologies. Anything which comes in front, it is called anterior. Now, there are two terms, guys. We have already discussed this yesterday. There is something called as anterior and there is something called as posterior. Now, anterior, Hindi में आगे, the one which comes towards the front of the body, right? It is towards the front, and posterior means towards the back of the body, towards the back of the body. Now, it is a plane, guys. Be very clear with the term. It is a plane that is dividing like this. Okay, it divides the body into anterior part and posterior part. Okay, so that is why it is called as the frontal plane or the coronal plane. There is a coronal suture also. I will come to that suture part when we will discuss the joints. As of now, remember, it is dividing the body anteriorly and posteriorly, right? So it is passing like this. So it can divide the body anterior and posterior, right? Yes, carry on. Very, very good. So remember, it is a plane. It is a plane that divides the body, into anterior and posterior. Okay, into anterior and posterior. Or anterior, I can simply say it is the front, and posterior means the back. Posterior means the back. Yes, Tatya, very good. Imamul, very good. Very good, guys. Now, before moving on to the next wala part, let me just ask you one question over here. Okay, can you tell me the plane which is in blue? Which plane is this marked as A? The plane which is marked by B. Just look at the image and please tell me what is A and what is B. What is A and what is B? So yes, हाँ साथिया ठीक है. You guys are going to tell me what is A and what is B. Which planes are these? हाँ, हमने वो ठीक है. Yes, Nike, very good. Muhammad Yasir, very good. Ishrat, yes. Mid sagittal and frontal plane. Very good. Very good. Ishrat Fayaz. Zara, mid sagittal. Aman, frontal. Very good. Tanun, mid sagittal. Harion, Dipender. Very good. Very good. Very good. Nike. Yes. Anjana, Zara, very good. Perfect, guys. You guys are like awesome. So A is basically the mid sagittal plane. Okay, and B is basically the frontal plane. B is basically the frontal plane. Yes, Anjana, Tarun, very good. Very good. Now coming on to the next plane, that is the transverse or the horizontal plane. The transverse or the horizontal plane. Now guys, you can very well see over here, this is the transverse plane. Okay, this is the transverse plane. Now this plane is basically dividing the body into upper part and lower part. It is dividing the body into upper part and the lower part. Yes, it is dividing the body into upper part and lower part. Okay, so remember, it is a plane parallel to the ground, right? It is a plane parallel to the ground surface. It is parallel to the ground surface. A plane parallel to ground surface, and it divides the body into upper half and lower half. Exactly, not half. You can just write parts into upper part and lower part. And it divides the body into upper part and lower part. Yes. Aman, you are right. Aman, you are right. Yes. Imamul, हाँ वो वाला भी हम उस पे आते हैं. I hope this is clear, guys. I hope this is clear. The transverse or the horizontal plane. This is the plane which I can just simply draw like this. This is the transverse plane, the transverse plane or the horizontal plane, the transverse plane or the horizontal plane. Now guys, coming on to the next one, that is, yes, the oblique plane, guys. Coming on to the next one, that is the oblique plane, guys. Now, what is meant by the oblique plane? Yes, what is meant by the oblique plane, guys? Now, oblique plane is something. Now, let us just try to draw it over here. Now, whenever you cut a part of the limb like this, right, in an oblique fashion, okay, in an oblique manner, such that it will make an angle with the ground. Obviously, let me just show it over here. If you're cutting like this in an oblique manner, Okay, if you're cutting the part of the limb in an oblique manner, such that it is making an angle with the ground. If you can just see over here, it is making an angle with the ground. It is making an angle with the ground. Yes. So that is exactly the yeah, the oblique plane, right? It is a plane. Remember, it is a plane. It is a plane making an angle with the ground, making an angle with the ground. Plane making an angle with the ground. Plane making an angle with the ground. So we have already discussed all the anatomical planes: the mid-sagittal plane, the sagittal plane, the coronal or the frontal plane, the transverse or the horizontal plane, and the oblique plane. All the planes are done. All the five planes are done. All the position, the lateral, lithotomy, fundamental, prone, supine is done. So just give me a thumbs up if all the positions and all the anatomical planes are clear to you guys. All the anatomical planes are clear to you guys. So yeah, I would be starting with the terms in the cross anatomy. But before that, I want a thumbs up from everyone who is attending the session. Yes, yes, Satya, you're right. So just give me a thumbs up in the chat box if this is clear. Yes, Aman, very good. Now, Vedant, Amreen, very good. Nike, Zara, perfect. Perfect, guys. Anil, very good. Herion, very good. Ishrat, perfect, guys. Sure. Tarun, very good. Hmm. Sure. Anjana Paul, Rakibul, Amreen, perfect. George, Shushan, Johra, Satya, perfect, guys. Now, coming on to the next very important part, that is the terms in the cross anatomy. Guys, many students have seen no struggling with the anatomical terms, right? If you are not clear with the basics, you will not understand anatomy. I will say posterior, inferior. Okay, if I say superior medial position, superior medially. So everything in anatomy, like it is the basics wala part. You cannot no take a chance to forget all this. You can just go through it, Jaya, right? Please, just listen from here. You will understand this, right? You can watch that later on. It will be there on the channel, right? Now, the term anterior, the term anterior basically means, yes, remember, towards the front of the body, towards the front of the body. Now, I want to ask everyone over here in the chat box. Yes, Aman, you are right. Towards the front of the body. Can you tell me? Okay, the sense organs which are lying on the anterior part of the body. The sense organs which are lying on the anterior part of the body. Can anyone tell me the sense organs lying on the anterior part of the body? Yes. बताइए. The sense organs lying on the anterior part of the body. Hmm. Yes, Ishrat Fayaz, very good. The nose, the eyes, guys. You can see the eyes, the nose, they're lying towards the front. Anything which comes in the front, it is anterior. Okay, it is anterior. Even the term ventral, guys, you will see the term ventral. Okay, it was earlier used for the animals. Nowadays, it is used in human anatomy also. Sometimes, yes, Amreen, very good. Rakibul, Herion, Nike, Raviraj, Ishrat, Anthony, Tarun, Satya, Imamul, very good. Jora, very good. Anjana, very good, guys, very good. So anterior basically means towards the front. In animals, earlier we were using the term ventral also. In no, you will see the term ventral for anterior also, right? So yes, Aman, very good. So yeah, coming on to the term posterior. So the term posterior simply means towards the towards the back of the body, towards the back of the body, right? Posterior, sometimes you will find the term dorsal for it. Dorsal. Posterior के लिए dorsal, anterior के लिए ventral. So sometimes you will find dorsal also. Yes, dorsal also. Towards the back of the body, right? Can you tell me any bone which is present posteriorly? A flat bone which is present posteriorly. Anyone would like to tell the flat bone which is present posteriorly? I'm waiting for your answers, guys, in the chat box. No. Rakibul, yes. Zara, very good. Ishrat, very good. Anjana, Nike, very good. It is the scapula, guys, that is located posteriorly, the shoulder blade. Yes, the shoulder blade. Aman, very good. Tarun, very good. Johra, very good. Harion, very good. So you can see the posterior, basically, I'm referring towards the back of the body, right? The back of the body. Any anatomical region which is present posteriorly, which we have discussed yesterday. The very famous anatomical region present posteriorly. चलो let me know दीपेंद्र ठीक है रकीबुल ठीक है. It's all right. Superior. Meanwhile, you're commenting the anatomical region which is present posteriorly. Let us just I'm writing on the second wala part. Yes, I'm writing on the second wala part. That is the superior, guys. Superior means hmm. हाँ स्कैपुला तो ठीक है. Hmm. हाँ Ishrat, very good. Satya, हाँ Ishrat, very good. It is the gluteal region, guys. You can very well see it is present posteriorly. The gluteal region, right? The gluteal region, right? Yes, very good. Johra, Aman, very good. Back is also yes. Amreen, very good. Yeah, Nike, back, gluteal. ठीक है तरुण. Okay, Hariyan, very good. So, superior means basically towards the top of the body, towards the top of the body, towards the top of the body, right? Towards the top of the body. Inferior means towards the bottom of the body, towards the bottom of the body, towards the bottom of the body, towards the bottom of the body. Now, now you guys are going to tell me, okay. Hmm. Okay, let us take a very common example, the lungs, and you already know we have a thyroid gland. Now you guys are going to tell me which one is superior and which one is inferior according to the normal anatomical position, keeping the body in the normal anatomical position. You guys are going to tell me which one is superior and which one is inferior. Yes, Amreen, you are right. Amreen, you are right. But before that, please let me know which one is superior and which one is inferior. Hmm. So that is something you guys already know. So let me come to the most important terms, that is the medial and the lateral. The medial and the lateral. The medial and the lateral. Hmm. Thyroid gland is superior. Why? Because thyroid gland is present in which anatomical region, guys? Yes, thyroid is superior. Tarun, right? Physiology. Lung is inferior. Thyroid gland is present in which anatomical region, guys? Yes, Herion, you are right. Aman, you are right. Absolutely, you are right. Zara, you are right. But you are going to tell me the thyroid gland is present in which anatomical region? And the lungs are present in which anatomical region? Yes, Herion, very good. I'm not asking about kidney. The thyroid and the lungs. Yes, thyroid is superior. हाँ बताओ. Yes, Tarun Singla, very good. It is the neck region. Yes, it is the neck region, guys. हाँ, Sabrina Mohabati, yes. Yes, Ishrat, Zara, Aman, very good. Hmm. Sure. Very good. Very good, guys. Physiology, Zora Zamani. Very good. Very good. Sabrina. Hmm. Tarun, thorax. Lungs is present in the thorax wala part. Yes. And the thyroid is present in the neck. That is the anatomical region. Imamul, very good. Now coming on to the next term, that is the medial and lateral. Now guys, try to understand this with the help of this particular part. Now guys, you already know this is called as the mid-sagittal plane, or I can simply say that this is the midline of the body, right? This is the midline of the body. This is the midline of the body. Now, I have to discuss two terms. The first one that is called as the medial, the next term that is the lateral. Now guys, try to see over here guys, what is the difference between the medial and the lateral? Yes. Now guys, anything which comes closer to the midline of the body, that is called as medial, and anything which is away from the midline, it is called lateral. So let me explain this with the help of two examples, right? Let us take point A and let us take point B. Now you guys are going to tell me out of point A and point B, which one is closer to the midline? Now you guys are going to tell me which one is closer to the midline of the body. Point A or point B may say which one is closer to the midline of the body, right? And automatically you get the answer. Anything which is closer to the midline of the body. Yes, Herion, very good. Herion, very good. Yes, Ishrat Fayaz, A is the medial wala part. A. Sabrina, very good. Nike, very good. Very good, guys. Towards the midline, legend. Yes. Tarun, very good. Physiology. Okay, Nike, Georgia, Imamul, Aman, Anjana, Zara, legend, Zura. Very good. Very good, guys. You guys already know anything which comes closer to the midline. It is said to be medial, and the other one is said to be lateral. So remember guys, medial means towards the midline of the body, towards the midline of the body, and lateral means away from the midline of the body, away from the midline of the body. Medial means towards the midline of the body. Lateral means away from the midline of the body. Away from the midline of the body. Now guys, you guys already know. You guys are going to tell me in the normal anatomical position. Okay. Yes, you guys are going to tell me in the normal anatomical position out of the little finger and the thumb. We have the little finger and the thumb. We have the little finger and we have the thumb. Which one is medial and which one is lateral? Which one is medial and which one is the lateral wala part? You guys are going to tell me. Yes. I'm waiting for your answers, guys, everyone. Hmm. Out of little finger and thumb, which one is medial and which one is lateral? Yes, Ishrat Fayaz, little finger is medial. Everything I have told you guys, it is described in the normal anatomical position. So when you keep your hands like this, when the palms are facing forwards, the little finger is automatically medial. The little finger is automatically medial. Yes, Imamul, Sabrina, Zara, very good. Everyone has commented, I suppose. Ishrat, Zora, Georgia, Physiology, Osama, Zara, Sabrina, Imamul, Anjana, Aman, Legend. Yes, Khan Sahib, Satya, Tarun, yes. Yes, you guys already know that have already told you in the normal anatomical position. Everything is studied in that position only. Even in the cadavers, you have to assume that particular position. So the little finger is automatically medial and comparative to the thumb. Yeah, the thumb is lateral. Carry on. Gia, very good. Very good, guys. Now coming on to the next term, that is the proximal and distal. Okay. Now proximal basically means towards the center of the body, towards the center of the body, and distal means away from the center of the body, away from the center of the body. Now guys, very very important, these two terms. Proximal starts from P, which is pass. Distal basically means D, which is dur in Hindi, right? So physiology. Can you please come up with your original names? It is not very difficult to know read out the names when the comments are like flowing rapidly. So yes, I would request you the physiology to come with the real name. Sabrina. हाँ ठीक है. Now proximal and distal guys. Firstly, there is a condition while describing this particular term that these two terms are basically described on the same limb. They are described on the same limb, guys. Yes, they are described on the same limb. Now, let us understand this with the help of an example. Now, guys, if I take 2 points, I'm taking point A over here. I'm taking point A over here and point B over here. Now, you guys can very well see over here that point A, it is on lower limb, and point B, it is on upper limb. Now, if I have to use the anatomical terms proximal and distal, can I use in these two positions? Firstly, the question is, can I use proximal and distal for these 2 points? I want the answer yes or no, guys. Can I use the proximal and distal for these two positions? Just yes, Sabrina, that is something you guys have to be very clear of. Can I use this or not? Yes or no? Sabrina, no. Zara, no. Very good, guys. You should be very much clear with the fact, guys. Both the points are taken on the same limb. Both the points, yes, Ishrat, very good. Anjana, Aman, very good. Yes, not the same limb. Very good. One is the lower limb, one is the upper limb, and I cannot use the term proximal and distal for these 2 points because they are not exactly present on the same limb. They are not exactly present on the same limb. Yes, Khan Sahib, I will teach whole anatomy if you continue to attend the sessions live with me. If you will attend the sessions live, I'm promising you I will teach the entire anatomy like this only. Not possible. Yes, no, 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 no. Yes. Now, let me take next example, guys. Over here, I'm taking only one limb. I'm taking point A and point B. Point A, or let me just take point B over here. They are on the same limb. Now you guys are going to tell me which point is proximal and which is distal. Again, guys, if you don't understand, just remember anything which comes first in the body, proximal, pehle, right? Distal is dur, which is more closer to the center of the body. It is said to be proximal, guys. Yes, it is said to be proximal, guys. So point A over here will be proximal. Hmm. Yes, I will complete it, guys. Don't worry. Yes, A is proximal to B. Very good. और B क्या हो जाएगा? Distal हो जाएगा as compared to A. B is distal to A. Yes, Dr. Kishore, very good. Yes, Aman, very good. Yes, 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 guys. So you guys should be very much clear with the fact. Hmm. Yes. A is proximal and B is distal. Yes. So I hope yes, everyone is right. Aman, Satya, Harion, Amreen, Zohra, Zatia, Tarun. Very good. Very good, guys. So you guys already know whenever we say proximal and distal, we are taking both the points on the same limb. Proximal is something which is coming in the body first. and then distal, dur wala, proximal pehle, that is the pass wala, right? Right, Amreen, very good. Now coming on to the next term, guys. So yes, that is superficial, now superficial you already know. Yes, Oplo, good evening, superficial you already know, it is basically towards the surface of the body, towards the, oh, I'll write it a little bit below because yes, superficial means towards the surface of the body. Yes, Imamal, very good. It is towards the surface of the body, right? Towards the skin. Yesterday we discussed below the skin which fascia is present, guys. Comment in the chat box, Sabrina, very good. Below the skin, which fascia is present, guys? You guys are going to comment in the chat box. Below the skin, which fascia is present? Hmm. Huh. Towards the surface of the body? Yes. And deep basically means away from the surface of the body. Away from the surface. Yes, Ishrat, very good. It is the superficial. Osama, very good. Zara, very good. It is the superficial fascia. Aman Jora, very good. Sabrina, Tarun, very good. Yes, midline, very good. It is the superficial fascia. So deep basically means away from the surface of the body. So superficial means towards the surface of the body. Deep means away from the surface of the body. Herion, very good. Mammal, very good. Yes, yes, yes. So deep means away from the surface of the body. Cephalic basically means towards the head part. Yes, cephalic का मतलब है it is towards the head वाला part, right? Now, in the head part, Imamul, very good. In the head part, two major things are included in the head region. Basically, two things we have discussed yesterday. Can anyone type in the chat box which two parts I'm talking about in the head region? Yes, which two parts I'm talking about in the head region? Yes. Hmm. हाँ, ठीक है, Sabrina. Okay, Imamul, very good. Hmm. Caudal means towards the tail. Towards the tail. Hmm. Towards the leg or towards the tail wala part, it is the caudal wala part. Midlife, it is right. In the head part, we have two parts. Yes, the skull and the face, the facial part and the skull. Yes, Jora Dimani, very good. Very good, Osama. Yes, the cranial bones, yeah, and the face wala part. Yes, yes, yes. Very good, very good. Laterality, guys. Coming on to the next one, that is the laterality. So in that, just look at this image, guys. Just look at this image. You guys will understand this with the help of this image, laterality. It's just very good. Unilateral basically means we are referring to only one side of the body, right? Unilateral basically means we are referring to only one side of the body. Bilateral means both the sides of the body. Bilateral means both the sides of the body. You guys are going to tell me out of A and B, which one is right and which one is left. Which one is right and which one is left? George Asia, Nike, very good. So, yes, out of A and B, which one is right and which one is left? Bilateral means both the sides of the body. Yes. Yes, Sarah, very good. A is the right wala part, MetLife. I just wanted to test you guys. I have already discussed yesterday the right and the left. Basically, they are decided with respect to the person, okay, with respect to the patient, with respect to the cadaver in front of you. It is not with respect to the doctor, guys. Yes, George, Sabrina, Tarun, Anjana, very good. Very good. Yes, towards the hip region or the foot region. Yes, Chia, you are right, beta. Yes. towards the lower part of the body. Yes, Khan Sahib, very good. Imamul Haq, Zara, Harion, Zohra, very good, very good, very good, guys. So yes, A, it is the right wala part, and B, it is the left wala part. Yes, ipsilateral, basically we are referring to the same side of the body, right? And contra means opposite. We are referring to, for example, upper limb of the right side and lower limb of the left side, or it can be vice versa as well. It, yes, Imamul, very good. Mohabbati, very good. Yes, it can be, yeah, the same way. So just try to, I'm trying to summarize this laterality. So when we say unilateral, we are referring to only one side of the body, one side of the body. Bilateral means referring to both sides of the body, both sides of the body. Ipsilateral means on the same side of the body. On the same side of the body. Contralateral means on the opposite side of the body. On the opposite side of the body. Ipsilateral means on the same side of the body. Contralateral means on the opposite side of the body. So yes, after this, we have already completed now the terms in the general, the gross anatomical terms we have already discussed. So just give me a thumbs up in the chat box if all the gross anatomical terms are clear to you, right? All the anatomical planes are clear to you. All the different positions that we have discussed today is clear to you. So we are over with the three topics that we have, the major three topics. Yeah, so just give me a thumbs up in the chat box if this is clear to you guys. Please be with me, guys. Try to learn along with me. Try to write along with me. If you write along with me, if you listen to the lecture live, it is going to benefit you a lot. Except like watching the video after this, it's of no use. I personally believe that if you are learning along with me, it will benefit you a lot, a lot, a lot, guys. Yes. Zara, Aman, MetLife, Sabrina, Zohra, Ishrat, George, Isha, Imamul, very good guys, very good, very good. Tarun, very good. Now, yes, now guys, coming on to the next very important topic, that is the anatomical movements. That is the anatomical movement, guys. That is the and Dr. Kishore, very good. Coming on to the next topic, that is the anatomical movement, guys. Yes. Hmm. Now, the very first one, guys, that we are going to discuss over here, the very first one that Subhajit, very good. The very first one that we are going to discuss over here, it is the two anatomical terms, that is the flexion and extension. The flexion and extension, guys. The flexion and extension. Yes, the flexion and medlife. Yes. Imamul, yes. Now guys, try to be very clear with the definition. Try to be very clear with the definition. Yes. हाँ ठीक है इमामुल वो भी ठीक है. Now flexion basically means yes. Now flexion is a very simple word which means bending, which means bending. Now an extension means straightening. Extension means straightening, right? Straightening, right? Flexion means bending and extension means straightening. Yes. Yes. Sabrina, Harion, very good. Jora, very good. Now, now it is the movement, guys. It is the movement, guys. Now, very well. See over here, guys. Now, let me just try to show you over here. Okay, there's no image. Hmm. Hmm. Now, let us just try to focus over here, guys. Let us. Yes, Subhajit, you are very much right. Yes. You're very much right. Now let us just try to look at over here. Guys, obviously you can see this particular joint that is called as the elbow joint, guys, right? This is called as the elbow joint. I hope everyone can see over here. If I just try to show, this is the elbow joint, guys, right? This is the elbow joint, right? Now, now, yes, carry on, very good. They occur in the sagittal plane. Now, guys, try to see this region, it is the arm region, and this is the forearm region. I have already told you yesterday, from shoulder joint till the elbow joint, this is the upper arm, and from the elbow joint to the wrist joint, we have the forearm. We have the forearm, right? Now, guys, you already know it is just like a straight line right now. It is just like a straight line right now. And whenever there is an angle of the straight line, it is 180 degrees. It is 180 degrees, right? It is 180 degrees, right? Now, assuming I am bending my forearm towards the arm, right? So it is going like this, guys. See, now this 180 degrees angle will reduce at this particular joint. Now this bending, okay, this decrease in size of the angle, it is called as flexion at the elbow joint. This is called flexion at the elbow joint, right? So you can very well see it is called the flexion at the elbow joint. So yes, now whenever I say flexion, guys, whenever I say flexion, so remember, yes, and very good, Imamul, very good. It is the movement which includes, right? It is the movement which includes the decrease in the angle of the joint, decrease in the angle of the joint, decrease in the angle of the joint. You guys already know in a straight line we have 180 degrees, right? And as the forearm is approaching towards the arm region, the angle is constantly decreasing. So anyways, decrease in the angle at a particular joint, it is called flexion. It is called flexion. Now opposite to this movement, increase in the angle at the joint, it is called extension, right? It is called extension. We will come to know a lot number of muscles like flexor muscles, extensor muscles. So you should know what does flexion means and what does extension means. Extension basically means increase in the angle of the joint. Extension basically means increase in the angle of the joint. Increase in the angle of the joint, or increase the angle between the two parts of the body. Increase in the angle of the joint, or it is increase in angle between the two parts of the body, between two parts of the body, right? And decrease in angle between the two parts of the body, decrease in angle between two parts of the body, between two parts of the body, right? So I hope this is clear to everyone. I hope this is clear to everyone. Now, in the leg wala part, guys. Now you already know that this is the knee joint. This is the knee joint, guys. Now, if I want flexion in the knee joint, how will the leg move? And yes, how will the leg move so that I can do flexion at the knee joint? You guys are going to tell me in the chat box. Chalo guys, let's learn with the concepts also over here. You guys are going to tell me how the flexion will occur at the knee joint. How will the leg move, guys? How will the leg move? चलिए बताइए बताइए. जल्दी से बताइए, हाउ विल द लेग मूव? Sabrina, Georgia, very good guys. Yes, yes. Aman, very good. Sabrina, Tarun, Johra, very good. Anjana, very good guys, very good. Yes. The leg will move backwards, guys. The leg will move backwards just to show the flexion, decrease in the angle of the joint. Yes, 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 guys. You guys are right. Midlife, very good. And extension. In extension at the knee joint, what? How will the leg move, guys? How will the leg move? Sayyid Yunus, very good. Yes, how will the leg move in case of the extension at the knee joint, guys? In case of extension at the knee joint. Hmm. Chal. Yes, literal. No. Mm-mm. Mm-mm. Forward Jura, very good. The leg will move forward in case of extension of the knee joint. Yes, perfect. Now coming on to the next one, that is the abduction. Sabrina, yes, yes. Straightening of the leg, yes. Straightening of the leg, very good. Now coming on Georgia, very good. Now coming on to the next term, that is the abduction, guys. That is the abduction. That is the abduction. Now abduction simply means now abduction means basically now let us suppose that this is the midline of the body. Let us suppose this is the midline of the body. If the part of the limb is going away from the midline, abducting, अगवा करना, ठीक है, दूर लेकर जाना, abduct, it is going away from the midline of the body, it is called abduction. It is called abduction. Zara, Anjana, very good. And adduction simply means if you are adding the part of the limb towards the midline or towards the side of the body like this, you are adding this particular limb towards the side of the body. That is called adduction. Add. If you just see the term adduction, add means to sum up. Okay, you already know addition. You are adding the limb towards the midline of the body. That is adduction. And abduction simply means taking the part of the limb away from the midline, away from the midline. Yes, yes, Jora, very good. Very good. Just try to pen down the definition over here. Yes. So abduction means movement of the limb, movement of the limb. Yes, away from the midline, right? Away from the midline. Yes. And adduction means movement of the limb towards the midline of the body, right? Towards the midline of the body. Just write down towards the midline of the body, towards the midline of the body. Movement of the limb away from the midline of the body and movement of the limb towards the midline of the body. Abduction and adduction. Hmm. Yes, I hope this is clear to everyone. So you will come across some terms, guys. Abductor muscles, adductor muscles. Now you have to have a clear picture in your mind. What is adductor? Adduction, which will help in adduction. What is adduction? Movement of the limb or movement of the part of the body towards the midline, right? So you have to, yeah, be very much clear. Yes, very good, Anjana Paul, very good. You have to be very clear with these terminologies, guys. Now coming on to the term pronation. Okay. Now coming on to the term pronation. Hmm. Now coming on to the term pronation. Yes. Pronation किसने लिखा है? Anyone? Hmm. Hmm. Now firstly guys, you have to be very much clear that pronation and supination are rotatory movements. Okay. Are rotatory movements occurring in the forearm. Okay. Occurring in the forearm only. right? Along, matlab, palm is also moving along with that. But as of now, you should remember they are the rotatory movements occurring only in the forearm, right? Right? So remember, guys. Hmm, now, just try to see over here, guys. Now, you already know when I say pronation, guys, pronation, just remember pants. Pants from P, you already know we have palm, and from P, you already know we have pants. We are wearing the pants downwards, guys. We are wearing the pants down. So you automatically have to know, click in mind that the palms will be facing downwards or the palms will be facing forwards. Movement of forearm in such a way that the palms are facing downwards or palms are facing backwards. That is something which is called as pronation. Yes, that is something which is called as pronation. Anjana, yes. Hmm. Yes, supination and pronation, it is with respect to this wala part, that is the forearm wala part. So remember, beta, remember, pronation basically means movement of the hand and the forearm, right? Movement of hand and forearm to bring the palm facing downwards or backwards. It is called as pronation. Okay, when the palms are actually facing down, the palms. Now, if the palms are facing upwards, okay, or in front, it is called supination, guys. Superior. Okay, when the palms are facing upwards, okay, or they are facing in front, or they are facing in front, guys. That is called as the supination, guys. That is called as the supination, right? So remember the same thing that I will write it over here. It is the movement of the hand and forearm to bring the palm facing upwards, okay, palm facing upwards, or it is front or in front. That is simply that is the supination, right? So you can very well see that we have, yeah, over here this is the pronation where the palms are facing downwards along with the forearm, and as you rotate like this, see guys, check. Just missed my pen. Just give me one. So you guys can see over here that now the palms are facing upwards, it is supination. If the palms along with the forearm, they're facing downwards, it is called pronation. Or they are facing backwards, it is called pronation, guys. It is called pronation, right? So yes. Now, so that is pronation, and that is, you can see the palms are facing upwards superiorly. That is called as supination. That is called as supination. Now, coming on to the next term, that is the circumduction. The circumduction. Now, circumduction basically means the circular movement. Remember, it means the circular movement of joint. Circular movement of joint using combination of all the movements that we have discussed, whether it is flexion, extension, Yes, abduction, adduction, right? Such that, yes, such that the distal limb describes a circle, describes a circle. Okay, such that the distal limb describes a circle. Yes, Sabrina, very good. Carry on, very good. So you can very well see that is the circumduction movement, right? That is the circumduction, right? Which you can see. So it is a group of all the movements, right? It is group of all the movements, abduction, adduction, flexion, extension, such that yes, the shoulder joint, the hip joint, right? So yes, that is about the flexion, extension, abduction, adduction, pronation, supination, circumduction. So before I move on to the next one, just give me a thumbs up in the chat box that these all points are clear. Yes. हाँ midlife बिल्कुल होगा ना बेटा. You're getting like this, then this, going in front, flexion, extension, everything like this, right? And yes, sure. Just give me a thumbs up in the chat box if this is clear. Now I'll come to the ulnar and the lateral deviation. Yes, you can just see, guys. Yes, over here also you can just see that the distal limb, it is describing a circle over here. Yes, that is circumduction, right? Very good, guys. I hope everything is clear. Going great. Yes, Soumya Ranjan. Okay. फिर थोड़ा सा फास्ट, बहुत ज्यादा स्लो जा रहा है. ओके, स्लो. चलो. Now coming on to the next term, that is the ulnar and the radial deviation. Ulnar and the radial deviation. Now guys, you already know. Now guys, you already know that we have the shoulder joint over here. Let us just try to understand this clearly. I will talk about the bones also, but as of now, just try to clear this. Yes. So you guys already know we have the shoulder joint, we have the elbow joint. Yes. We have the wrist joint over here. Yes. We have the wrist joint. Now, from shoulder joint to the elbow joint, this region it is called as the arm or the brachium. It is called as the upper arm or the brachium. From elbow joint to the wrist joint, this region it is called as the forearm or it is called as the antebrachium. Right? It is called as forearm or it is also called as antebrachium. Right? Now, in the arm region, basically a bone is present. Only one single bone is present, and you already know the name of this particular bone, and this is called as the humerus. This is called as humerus. That is the funny bone that is present in the arm region, right? Now, coming on from the elbow joint to the wrist joint, two bones are present, right? Two bones are present over here, right? One, it is called as ulna, and one, it is called as the radius. Now be very clear with the terms, guys. Over here, very important. Be very clear with the terms. Now, when I say ulna and when I say radius, now you guys are going to tell me out of ulna and radius, which one it is closer to the midline of the body in the normal anatomical position. Zara, you are right. Yes, Sabrina, you are right. Amreen, you're right. Which one it is closer to the midline of the body in the normal anatomical position? Virtual reality. Okay. Hmm. Yes, Sarah, very good, guys. You already know. Yes, you already know. Let us suppose that this is the midline of the body. Let us suppose that this is the midline of the body. That is the midline of the body. Yes, that is the midline of the body. Yes, ulna is present medially as compared to radius. So ulna, it is the medial bone of the forearm. Ulna, it is the medial bone, and radius, it is the lateral bone of the forearm. In the normal anatomical position. Yes, Dr. Raja Ranjit Verma, very good. Yes, George, Sabrina, very good. The radius, it is the lateral bone of the forearm. Lateral bone of the forearm, right? The medial bone of the forearm, it is the ulnar. So yes, when I say ulnar deviation, guys, now I'm simply talking about the wrist wala part. The wrist wala part. The wrist, it is moving towards the midline of the body. Now, automatically, if the wrist move towards the midline, the ulnar, it is the ulnar deviation only, right? If the wrist it is moving away from the midline, it is the radial deviation. It is the radial deviation, guys. So remember, the ulnar deviation means movement of wrist, movement of wrist अरे, towards midline, because ulnar it is basically the medial bone, right? And radial means movement of wrist away from the midline. Movement of wrist away from the midline, right? So yes. Hmm. Opposition and reposition, guys. Opposition and reposition. Just try to look at this particular picture. Opposition and reposition, guys. You can very well see that. Now this is the thumb and this is the little finger, right? Now if the tip of the thumb touches the tip of the little finger, it is called opposition. Oppose kare. They are trying to oppose each other, right? That is opposition. If the thumb and the little finger come back in its normal position, it is called reposition, guys. It is called reposition. So be very clear with the terms. So write it down. Yes, we have already discussed this opposition and reposition. So write down that opposition means, yes, thumb brought to oppose another digit. Yes, very good. Thumb brought to oppose another digit, right? And reposition means thumb repositioned back to its normal anatomical position. Repositioned back to its anatomical position. Anatomical position to its anatomical position. Yes, yes, virtual reality. Okay. Now, coming on to the next one, that is the elevation and depression. Elevation and depression. You guys already know we have something, a bone over here that is called as the, yes, scapula. 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 So remember, whenever the scapula is going up, whenever the scapula is moving up, elevation, elevate. The scapula is moving up, superiorly it is elevation. When the scapula is moving down, it is called depression. It is called depression, right? So remember, very simple terms, elevation simply means movement of scapula superiorly, movement of scapula superiorly. Depression means movement of scapula inferiorly. Movement of scapula inferiorly. Elevation means movement of scapula superiorly. Depression means movement of scapula inferiorly. Right? Now coming on to the next term, that is the inversion and eversion. Okay, inversion and eversion, you guys have to know that they occur at the ankle joint. They occur at the ankle joint. These anatomical movements, they will occur at the ankle joint, right? Now you already know the sole of the foot, right? The sole of the foot that we have discussed yesterday. The sole of the foot that we have discussed yesterday. Now, remember guys, movement of the sole towards the median plane, towards the median plane, right? And eversion means movement of sole away from the median plane, away from the median plane, right? So the sole, it is the lower part, the plantar surface of the foot, right? I have already told you if the sole it is moving towards the midline, it is inversion. If it is moving away from the median plane of the body, it is eversion. Coming on to the next two terms that is very, very important, that is the dorsiflexion and plantar flexion. Now, dorsiflexion and plantar flexion, guys, just try to see over here. Let me just draw this. You guys already know. Yes, right? So this surface, it is called as the dorsum of the foot, and below the surface, it is called as the plantar surface of the foot. The plantar surface of the foot, right? Now, this is the leg. Now we have to do dorsiflexion. Dorsiflexion means the dorsum of the foot. How you can do the dorsum? How will you move the dorsum part of the foot in such a way that it causes flexion? You will move towards the leg or away from the leg, guys. You guys are going to tell me how will you move the dorsum of the foot? Flexion means that there should be a decrease in the angle. Flexion means there should be a decrease in the decrease in the angle. Dorsiflexion. How it will move, guys? Tell me. Yes, anterior to the leg. Very good, Sabrina. Yes, when the dorsum surface, when the dorsum part will approach towards the anterior part of the leg, right? In such a way that there is a decrease in the angle. Beta, there is an angle over here. Now, automatically, flexion simply means I have to decrease the angle. So it will go like this. It will go like this so that there is a decrease in the angle. Yes, Gia, just okay. I have that image or not? Let me just see. I don't have. Gia, I will I'll share my Instagram handle and I will text you over there, right? You just have to see, guys. See, Gia, this is the dorsum of the foot. This is the dorsum of the foot. This is the leg, the anterior part, the front part of the leg. So dorsiflexion, you have to move the dorsum of the foot towards the leg just to decrease the angle, right? Just to decrease the angle, right? So that is something that you have to keep in mind. Dorsiflexion simply means, yeah, movement of the dorsum of the foot in such a way, okay, movement of the dorsum of the foot in such a way that it approaches towards the front of the leg, causing a decrease in the angle or resulting from Nigeria. Okay, resulting a decrease in the angle, that is called as the dorsiflexion. That is called as the dorsiflexion, guys, right? Dorsum ऊपर की तरफ जाएगा leg की तरफ, so that there is a decrease in the angle. Plantar flexion. Now guys, you can see the angle over here, right? So plantar flexion, you have to decrease the angle. So movement of the plantar surface of the foot towards the posterior part of the leg, right? The plantar surface will go behind such that there is a decrease in the angle. That is called as the plantar flexion. That is called as the plantar flexion, guys, right? So remember, in the plantar flexion, when the plantar surface basically approaches posterior leg such that there is decrease in the angle. Yes, such that there is a decrease in angle. There is a decrease in angle. It is called as plantar flexion. So yes. Now I will tell you some more terms. Let us just try to look at the images, guys, over here. Let us just try to look at the images over here. You guys can see the flexion and extension. Can anyone tell me this flexion and extension, it is occurring at which joint? Shall try to answer in the comment section. Now it's your turn, guys, to quickly revise all the terms with me. Yes, carry on. Thank you. You guys are going to tell me, yeah, the flexion and extension, they are occurring at which joint, guys? They are occurring at which joint? Now, guys, you already know this is the normal anatomical position. Now, to decrease the angle, it is called, yes, to decrease the angle, it is called flexion. And to increase the angle, it is called extension in the normal anatomical position. This is flexion, this is extension, right? Yes, Tarun. Physiology, Sabrina, Amreen, Munfa, George, Zara, Jebimi, very good. It is occurring at the wrist joint, guys. It is occurring at the wrist joint. You can very well see that there is a decrease in the angle. And if the angle is increased at the wrist joint, it is called as extension. It is called as extension. Flexion simply means decrease in the wrist joint. Now, guys, if we simply talk about, yes, if I want to simply talk about the flexion and extension in the fingers, right? Okay, in the fingers, you already know that. Let us just try to see over here. Now, in the fingers, guys, can anyone tell me in the fingers? Just try to look at my hand. Now, you have to tell me which anatomical movement is this when all the fingers are going away from the midline, right? This is abduction or adduction, guys. Now, in case of fingers, basically the middle finger is taken as the point of reference. Again, very important. In case of fingers, in case of hand, basically especially the fingers, the middle finger, it is taken as the point of reference. The middle finger, it is taken as the point of reference. Yes, abduction, very good. Tarun, Zara, virtual reality, very good. It is taken as the point of reference, guys. It is taken as the point of reference. When all the fingers are going away from the middle finger, it is, yes, abduction. Abduction going away. If it is adding towards the middle finger, it is adduction. It is adduction. Yes, it is adduction. Right? It is the point of reference that you guys have to know, right? Over here. Supination, reposition, done. Now, you guys are going to answer this question. This is a clinical question, guys. This is a clinical question. Now, quickly revise with me, guys. Yeah. A 36-year-old man comes to a radiographer for an X-ray of the left knee. The radiographer asks the patient to straighten the knee in order to get a clear X-ray. The movement is referred as supination, pronation, flexion, and extension. Now, you guys are going to tell me which is the right answer, guys. तरुण सिंगला वेरी गुड बेटा जब भी हम स्ट्रेट कर रहे हैं उसका जो लेग है ना वो फोल्डेड था उसका ना लेग कुछ इस तरीके से था तो what the radiographer told just to straighten the leg. Earlier the angle was this. Now as soon as he straightens the leg, the angle becomes this, right? The angles become this. So obviously increase in an angle. Yes, Munfa, Malik, Zara, Georgia, Jivini, virtual reality, Hariom, Amrit, Sabrina, Frederick, Prakriti, Johra, very good. It is an extension, basically straightening or increase in the angle, right? That is simply called as the extension. Yes, yes, yes. Gia, very good, guys. Now coming on to the next question, guys. A 25-year-old man comes to a radiographer for an X-ray of the left foot. The radiographer asks the patient to turn the foot outward. To turn the foot outward, what is this movement called as? Supination, pronation, eversion, or inversion, guys? Yes, Jarka Khurshid. Hmm. Sure. I'm waiting for your answers, guys. Yes. Hmm. Yes, it is E version. It is E version. Very good. Jibimi, Munfa Malik, Sara Aftab, George, Jarka Khurshid, Amreen. Very good. Very good, guys. It is E version. It is E version. It is E version. Very good. Tarun, very good. Johra, Harion, very good. Coming on to the next question. Last question for today. I hope you might be tired, everyone. Prakriti, very good. A 35-year-old woman presents to a radiographer for an X-ray of the hand. The radiographer asks the patient to rotate the hand with palms facing downwards. What is this movement called as? Now, what is this movement called as? The last question for today, the clinical questions. You already guys know the paper, the examination pattern is now a more a days now more clinical parts are asked in the exam, right? So yes, George, very good. It is two. Zara, very good. Pronation. Tarun, very good. It is pronation. Whenever the palms are facing downwards, pants, right? It is down only. So obviously, it is the pronation. The yes, Jura, Amreen, virtual reality, Jibimi, Herion, very good. Prakriti, very good, guys. Very good. Sabrina, very good, guys. Sabrina, very good. Perfect. Hina, Kauser, very good, guys. So that is all about what we have discussed today, guys. I hope you all understood what we have discussed. We have discussed supine position, prone, fundamental lithotomy, lateral decubitus, all the anatomical planes. I have discussed all the anatomical terms today with you and all the anatomical movements, right? Again, if you have any doubts, guys, you can connect to me on my Instagram handle, that is Abhijit Kumar 7859. Okay, it is Abhijit Kumar 7859. And yes, I hope you all understood, guys. Just give me a thumbs up if you guys understood. Please share the video with your friends, right? With your friends, right? Spread the love, right? So please attend the sessions regularly. Try to make the notes along with me, right? Try to write along with me. Try to solve the questions that I'm discussing, all the previous year questions, all the clinical questions that I'm discussing. Yes, no, virtual reality, plantar flexion, it is going towards this. Now, when I'm saying outward, it is going away from the medial plane. It is like this, guys. When I say plantar flexion, it is going like this. But when I say eversion, it is going outward, it's going away from the midline, right? Sure, sure. I hope you all understood. Part one video link is there. It is there in the live section only. Jia, you can please uh, see over there, right? I think the video will be saved. You can watch it later as well. Hmm. Sure. जाऊं अब मैं? Okay. Goodbye, goodbye, guys. God bless you all. Thank you for the patience, for listening me out. I mean, sure. Okay. Please circulate this video with your friends, with all your MBBS friends, right? Sure. Goodbye, 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 guys.